Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's episode, we're going to be discussing a medication known as Tolbutamide. Its brand name is Orinase. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now, in this video, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Tolbutamide. We'll then touch on examples of dosing, and then finish it off with side effects. I've put together some slides to go over this information, so let's just jump right into it. So the first thing to discuss here would be the mechanism of action or how this medication works. So Tolbutamide is an oral blood glucose lowering agent which belongs to the sulfonylurea class. Like other sulfonylureas, Tolbutamide acts to increase the secretion of insulin, though it is only effective in patients who have some pancreatic beta cell function. In terms of indications or reasons we would prescribe this medication to a patient, we would usually see this medication prescribed in the treatment of type 2 diabetes mellitus. We may also see it used in the diagnosis of a neoplasm of the pancreas. With respect to contraindications or reasons we would not be able to prescribe Tolbutamide, first of all, we wouldn't give this medication to a patient who had a hypersensitivity to Tolbutamide or to any other component of the formulation. Medication would not be used to treat diabetic ketoacidosis with or without coma, as it should be treated with insulin. As well, type 1 diabetes mellitus, you wouldn't use this medication as a sole therapy, again because this condition should be treated with insulin. Now for dosing with Tolbutamide, so again in the treatment of type 2 diabetes mellitus, the initial dose would typically be 1 to 2 grams orally once daily in the morning, or it could be broken up and given in divided doses. The usual maintenance dose would have a range here of 0.25 to 3 grams orally daily, and the maximum dose would be 3 grams per day. As with all medications, there are some side effects or adverse reactions that patients may experience while using Tolbutamide, so I'll go over some of those here now. Some patients may experience epigastric fullness, as well as heartburn or nausea. Two serious side effects that may happen with Tolbutamide would be an increase in cardiovascular event risk, or severe hypoglycemia or low blood sugar. Alright everybody, that's all we're going to talk about today with Tolbutamide or Orinase. As always, I'm very thankful you took the time to go by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, or most importantly subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.